informed care. And just to inform everyone, this session has been recorded and will be available at a later date on the Housing Agency website, or YouTube channel, I should say. So the theme for today, second in the series, as I said, of trauma-informed care, and it's looking at trauma-informed care from a homeless service setting. And we're delighted to have Una Burns here today, who is the Head of Advocacy and Communications in Novus, based in Limerick, but Novus are a national organisation now. And Louisa Carr from Respond, who's the Head of Services at Respond, also a larger organisation who deliver a lot of social housing across the country and a lot of key homeless services as well across the country. So you're both very welcome today, both of whom I've worked with in the past in a previous life, but both who bring a level of experience and insight into the trauma-informed care journey, which I think is really important to help everybody understand the process, the workload that's involved in delivering trauma-informed practice in organizations, and taking a different perspective. So Una very much will be focused on the specific homeless services side, and Louisa, obviously Respond, being a large AHB, will have the context of both sides of the house, for want of a better description. So Una, I might call on you first to share your slides and get started, and just to let everybody know that there will be questions at the end. And they'll be via the chat function. So from that perspective, we'd ask, even if you think of questions as we go along, you might just hold them until the end of the presentations, and we'll work through them as best we can. And hopefully we'll be finished the session within the hour. So Una, I'll leave it over to you.
Thanks a million, Rob and Graeme, for inviting me to speak today. As Rob said, my name is Una Burns and I'm Head of Advocacy and Communications with Novus. And I am the chair of Novus's Trauma-Informed Practice Steering Group. So I'm here today just to share a little bit about our journey. We've been practicing or endeavouring to practice from the perspective of trauma-informed care since about 2018. So just to kind of bring you along our journey, to share lots of the mistakes we've made along the way, and to highlight the benefits of trauma-informed practice, both in terms of staff well-being, in terms of resident engagement, and generally overall in terms of the provision of services and housing for people, sometimes with significant vulnerabilities and complex needs. So just a little bit about this. Sorry, just sharing that there. Just a little bit about trauma-informed practice. So the principles, I suppose there is no one definition of trauma-informed practice or the principles of trauma-informed practice, but the 6 principles that we have guided our development over the last 6 years have been safety, trustworthiness and transparency, peer support, collaboration, empowerment, and understanding of cultural, historical and gender issues. So those principles, I suppose, are really important for us in terms of our TIAs or trauma-informed approaches in all our services across the country. And looking, I suppose, at why we implemented trauma-informed practice, I suppose initially, prior to the kind of language of trauma-informed practice, it was psychologically informed environments that really spoke to us. And really kind of explained the complex needs of our clients and the significant traumas that they'd experienced for years before they came into our services. And then I suppose when we refined that down to trauma-informed practice, it really helped us to both package the existing good practice that we were already doing within our organisation, and then to continue to develop those trauma practices as a way of keeping the people that needed our services the most, to keep them engaged and to keep them feeling safe within our services. Because often we'll find the people that need our services most are the people that are presenting with the most complex needs and find it hard to stay engaged. So in terms of adverse childhood experiences, and we're all very familiar with this language now, a piece of research by Dr. Sharon Lambert many years ago found that 77% of the homeless population in the research had experienced 4 or more adverse childhood experiences. In our services, we would say that that's much higher because we provide often low threshold services. So it's often people with the most complex needs. And this included very traumatic events like childhood sexual abuse, substance misuse in the family, and significant levels of adult domestic violence survival. And we provide particularly dedicated home services for women in Dublin. We find that every single woman that has come into our services would at some point have experienced domestic or gender-based violence. So it was important, like trauma-informed practice really spoke to us from that perspective. We developed the training because we felt it was an attempt to reframe, client behaviour in terms of trauma and its impact, and increased staff's awareness of their own behaviours and their own prejudice and values that they come to work with every day. Trauma-informed services understand the widespread impact of trauma and the psychological changes that happen to trauma survivors because of the things that they've endured, and then incorporating this understanding and awareness into our daily work practices and our organisational standards. So really trying to develop it beyond training to ensure that it's incorporated into our culture as our practices, our systems, our policies as an organisation. So we implemented it because despite our best intentions and our desire to heal, so often we missed those trauma triggers, and actually we re-triggered people unintentionally, through maybe, emulating behaviours that were very triggering to them. And we were missing trauma triggers. And so that we were kind of failing service users with the most needs. So we felt like by having a bespoke training, the focus on trauma and trauma triggers, we'd be able to better serve our clients and equip our staff on the front line with very demanding jobs to do their jobs better, to give them those skills and that confidence to do their jobs better. In terms of our timeline, and this is a real just quick snapshot, we first went about looking for trauma-informed practice training in 2017. There really wasn't anything out there at the time, particularly for homeless services, low threshold services. So we developed a kind of a social enterprise with Quality Matters at the time, where they developed the training. And as part of that, then we would get our own trainers trained in-house, so we could deliver that training ourselves, and became more sustainable. And also, as time went on, we found that really helpful to just manage our own training diaries. Then in 2018 and 2019, all of the staff were trained in trauma-informed practice. So that was a commitment we made from the outset, that all our staff, whether you were a cook, you were a frontline project worker, or you were the head of finance, that you'd be trained in that core trauma-informed practice training. And that was essential for us to really get it into our systems and our culture and our policies. In 2020 then, with the onset of the pandemic, we had to move all our training online. And we kind of developed a new kind of induction that included trauma-informed practice. It was kind of condensed, I suppose, with the nature of the pandemic. But we really realised that while it was harder to implement it during the pandemic, it actually was when we needed it the most, and really where we needed it the most for staff. Because suddenly, they're working in these really pressurised environments where the risk of contagion was it was imminent and all around and constant in their workplace and on the news. And also they were working in kind of with the same people all the time, because we had kind of working hubs at the time, and that brought its own challenges. So we had to find ways to continue our trauma-informed practice journey then. In 2020, we developed our trauma-informed practice steering committee, which is comprised of senior management members, and really that it has to be at the highest level of the organisation, that there's real buy-in from it, to make sure then that we're all engaging in it, for it to filter down into services and to staff and clients on the front line. Then in 2021, we developed I'm calling it TIP refresher training. There was actually TIP under pressure training. So this we recognised from some research we did in 2021 that the core training wasn't sufficient to maintain kind of a trauma-informed culture. We needed something that really focused on the vicarious and secondary trauma experienced by our staff just in their line of duty. So we developed this under pressure or refresher training, which really focused on frontline staff's well-being, provided tools to respond to traumatic situations, allowed them, really endorsed reflective practice so that staff could leave reflect before they left as a group, and try to help them to leave those traumatic experiences at work, and just to give them confidence and give them a sense of support while they're delivering their own roles. And then we developed champions and recruited champions, or what we actually now call TIP reps. So every service and department, and including our housing or approved housing body side of the business, have a rep representing them, and that trauma rep really is either like a project worker or a housing officer or a night support worker, and their job really is fundamentally to role model good trauma-informed practice behaviours, and to ensure the trauma-informed practice is, you know, discussed at every team meeting, every client meeting, and is modelled in the service. They don't have any managerial experience. We did develop a spoke champion or rep training, and that really kind of focused on kind of overall change management for non-managers and support them to roll it out in their service. We also in 2022 developed management training, and that focused on delivering team meetings and supervision through the lens of trauma-informed practice, again, so that staff were benefiting as much as clients through of that trauma-informed practice journey. And I think that was really key. And while we very much developed it with our clients in mind, you know, as I suppose the journey progressed, we really realised that, like, you know, unless you have a healthy staff team who are supported through the lens of trauma-informed practice, you're limiting the kind of benefits of it for the clients. You know, they're very intertwined. So we kind of want the experience to benefit our staff as much as our clients. We were involved in the development and ratification of TIP standards in the sector, and we had our first trauma-informed practice service audit. They are conducted externally, they're not conducted by us. Our staff are involved in it as much as just in terms of answering questions, but it's central to that survey are our clients and their experience. And it's really helpful to drill down very specifically to maybe the bits that you're failing in specific services, so you can really then have targeted you know, recommendations like for that specific service. So that has been really helpful. They're expensive enough now, so we haven't had that many TIP audits, but it's definitely something we're committed to doing 2 more this year. In 2023, we developed our trauma-informed practice policy, which was a long time in the making, and you know, probably like it should have been done years beforehand, but we got there eventually. It was something that had never been done before, so it was a real process for us, and that was ratified by our board of directors. We kind of constantly review our structures because there's definitely improvements that can be made all the time. We had our first national TIP day in all our services. So basically we have one day in November, it's our National Trauma-Informed Practice Day, where we celebrate all the trauma-informed approaches and actions we've made at local level. So we have TIAs at local level and national level. We celebrate those in the day, and it's really a day to involve clients in the process. Like, what do they expect when they come into a service that is said to be a trauma-informed service, and are we meeting their expectations? And then we also last year recruited new trauma-informed practice trainers so that they could train our staff internally. This year, obviously, it's only November, or it's only February, but we've already kind of made some changes there. We've added in a new TIP working group. So we found that there was a communications deficit. The managers were kind of being left out of the loop. So we created this new group of managers who are kind of the ones that are chairing the meetings with their rep group and feeding back into the steering group. So it's just to make sure that everybody in the organisation is involved in the process, so it doesn't become a process for one or two people to maintain, that it belongs to everybody and it's everybody's responsibility to build it into the culture. So just really quickly, I'm very conscious of the time, just around how it's support our staff, because sometimes staff feel like, oh, it's another training I have to do, it's another thing on my plate, but like it really does help staff. And we did a self-evaluation of our staff in 2021, looking back 2 years previously to when they've trained and how that training had helped them. And we found that it provided them with confidence to deal with challenging behaviours. It was an opportunity to recognise their own traumas and their own window of tolerance. It created a culture of reflection. So it really helped us to get staff to engage in other supports like PFA and EAP. It helped them to depersonalise the behaviour of clients and understanding the trauma-induced behaviours of the clients, and it reduced the number and severity of incidences in low-threshold services. And that's a really key piece. And just speaking to that, in 2019, so 1 year after we conducted the first round of training, when all our staff were freshly trained in trauma-informed practice for the first time, we did a piece of research in a low-threshold mixed-gender service in Limerick, and we found that the number of incidences in quarter one 2018 compared to quarter one 2019, like there was a significant reduction. Now, bearing in mind, there can be lots of reasons why incidences increase and decrease. You know, you could have one person that, you know, causes a lot of incidents in the service, you know, so bearing that in mind, but there was a significant reduction. And because staff were equipped to de-escalate incidences before they kind of increased, or before maybe emergency services would have to be called. So that was like really significant. And then we did the same kind of a similar piece of research in the Abigail Women's Centre in Dublin 2 years after training. So the first one was when the training was really, really fresh. So this was in the height of the pandemic, when everybody was in the service all the time, when staff were like working with the same people day in and night out for, like, at this stage it was Q4 2020. So they've been 7, 8, 9, 10 months working with the same people. So like, you know, the environment wasn't great anyway, but we found that while the number of incidents didn't reduce, there was a significant reduction in the severity of incidents. And so you can see there, number one, like, were the fatal, number two were like when emergency services would have to be called, and there was a significant reduction. So there was a kind of an increase in number 5 where there was no harm or injury, and a significant reduction in the number 2s and 3s. So again, it showed the staff were equipped to de-escalate incidents much more quickly and much more skillfully than they would have been before the training. So that really propelled us to think, right, you know, we can see that there's a slight dip in the training after a couple of years. So now everybody has to get core trained when they start Renovus, and 2 years later, they have to undergo that core training again, very much like any training you'd have, health and safety, first aid or whatever. And on top of that, the frontline staff do the under pressure training to support their own well-being at some point in between those 2 years. In terms of staff well-being, or retrospective self-evaluation of staff found that 71% of staff found that there was a reduction in taking client-related difficulties personally. 86% found increased confidence in working with clients who were in distress. 91% found that they had a greater ability to connect with clients who were in distress. And 79% found increased compassion towards service users, and actually self-compassion as well. So you can see right down there, like, there was like significant increases in positive outcomes for clients or for staff when they're working with clients with complex needs. So it was really helpful for them to engage in the process. And because they felt like that, you know, it increases your staff buy-in then in engaging in the training, because they know that it'll benefit them directly. Sometimes it can be a little bit overwhelming on how to start. What is a trauma-informed approach? What is a trauma-informed action? What's a local action? And how do I implement it? And especially because so much in the sector is out of your control in terms of funding or in terms of the buildings in which you provide services. But sometimes it can just be really small actions. And these are just some of the examples, like in terms of room checks in our young person service in Limerick. They implemented, you know, they spoke to the clients and said, look, we have to do room checks. They're part of health and safety, but would you like to be there when we do them? Would you like us to do them when you're not there? What time of the day suits you to do them? So just collaborating with the client and making sure the client's voice is center of all those health and safety checks, and equally sharing the rota. So like, why are we holding this information about staff rotas? Like, so we just share that in services now. So it's up on the wall, clients can see, and particularly if clients relate to a particular staff member and they're looking forward to them coming on shift, they can know when that person's there. In terms of paperwork, this was a really important one for outreach services who might find it harder to implement trauma-informed approaches. So like, you know, what do we need? What information is critical for us to get? Because sometimes I think, you know, people are telling the story over and over again, and that can be really triggering. So like making sure that we're not doing that when it's unnecessary, you know, taking into consideration that people might have language barriers, literacy barriers and things like that. In the Abigail Women's Centre, or bed linen used to be navy, and a lot of the women, you know, had been incarcerated and had been in jail previously and said, oh my God, this was the colour of the bed linen when I was in jail, and it was really re-traumatizing for them. And it was like, right, let's get rid of the navy bed linen, let's buy loads of, you know, colourful ones, and let people pick their bed linen that they want when they come in. And again, it was just involving people in the process and just reducing those triggers. We reviewed all our welcome and introduction to the service, like how can we make people feel welcome, you know, introducing them to other clients that live there, making sure, you know, it's like, oh, hi, Anna, we were expecting you, we're delighted you were able to come and stay with us, you know, and just making people feel really welcome and giving them a sense of safety when they come in, because that sense stays with them then. And then environmental changes, you know, sometimes can be the easiest and the hardest when like there's multiple occupancy rooms, but creating spaces outside for people when you're in a congregated setting is really important. Having therapeutic rooms is really important. And like even in office spaces that clients are coming into can be really important to make those like more friendly. Like for example, in our family service in Limerick, which is an outreach service. We were finding that we were working more with clients who were already homeless. So they were living in hotels and they didn't have any access to washing facilities. So we changed one of our office rooms into a laundry room. They could come in, you know, before that we'd been giving them vouchers for laundry. You know, when they went in, they couldn't do their laundry themselves. The laundrette knew they were homeless because they had this voucher. So this was like, you know, gave them back ownership of washing their own kids' uniforms, which was something that was really important to families. They could do it in a safe environment. We made the room really nice with a kettle so mom could have a cup of tea while she was doing the washing, or they could go upstairs and have a key working session with their key worker at the same time. So small environmental changes can make a really big difference for people. And I'm just going to finish on one quick story on how it can really keep our clients that are the most vulnerable engaged in our services, the clients that are most likely to disengage. Years ago, when we were starting this journey in one of our women's services in Dublin, there was a woman that you know, was displaying very complex behaviours, and anytime she asked for something to eat, you know, she'd escalate very quickly if she didn't get it. And one day she broke a window, and the manager was like, oh, anytime she asks for something to eat, it really triggers her. So the manager said, come in and have a chat. And normally, I suppose, if someone breaks a window, it might lead to an exclusion or an eviction. And the manager said, every time, you know, you ask for something to eat, I find that it's, you know, you escalate very quickly. And she said, yeah, when I was younger, my parents were both heroin users, and I'd ask for something to eat and I'd go days without food. You know, they say in a minute. And like, it brings me back when a staff member says, I'll be with you in a minute. I think maybe they won't be, and I'll be days waiting for food. So by kind of recognizing that trigger, and triggers are different for everybody, we were able to put a plan in place for her to keep her engaged, and that recognized her trauma. So I suppose that's just an example of how a small intervention can keep somebody that needs you the most engaged in your service by just recognizing their trauma. So that's it for me. Thanks, Rob.
Okay, thanks so much, Una. That was a great story and a great example to finish on. And I suppose just as we move on in the session, and Louise is going to come up now, I suppose the insights, there are over 100 people on the webinar today, and you've got people from homeless action teams around the country, local authorities, generally HSE, AHBs, NGOs specific to homeless services. It's great to be able to think about some of the context of that presentation, and you covered so many great things there. The outcomes and the KPI factor. And that's often a great way of gaining buy-in on a service. So from that perspective, I think there's certain people will find it easier to sell in that. But yeah, that was really great presentation, and we'll come back to questions on the end. I definitely have a few more. Louisa Carr from Respond, you're next up, so we'll leave you to it. Thank you.
Hi there, thank you, Rob. So hello everybody, thanks for joining us this afternoon. So I'm just going to talk a little bit about Respond as an organisation and how we have become or are becoming a trauma-informed organisation. So as many of you will know, Respond is quite a large approved housing body. We have currently 7,084 properties. With that is 15,991 tenants. But a huge part of our organisation is also a variety of services, and across those services in 2023 we supported approximately 2,000 service users, and then across our full organisation we have 350 staff. So just have a little look at our services side of things for a second, just to explain or give some context. We have 15 early learning and school aged care services. We have 6 family homeless services across the country. We have 3 daycare centres for older persons. And we have refugee resettlement programs. So we've done 8 of those to date, and we currently are the implementing partner in Cork, Waterford and Louth. And we also run family support services in 3 counties across the country. So why we decided trauma-informed care? So I suppose because of our services background, myself and some of my colleagues were involved within obviously the homeless services, and we could see the value of what trauma-informed is bringing to those vulnerable groups. We're also involved with FIANSA in Europe and with the Health and Homeless Working Group. And I suppose from linking with the likes of UNA and Novus and Equality Matters, we really began to see the benefits of having psychologically informed environments and the real benefit of using trauma-informed care. I suppose what we do obviously, and like many other housing associations and local authorities, we work with tenants across the life cycle of their time. But with our service users, it's a lot more transitional. So the nature of those services would be more short term. So we began seeing, and I suppose as an organisation, a bigger focus on our tenants, on the service users, and on the, I suppose, the staff and the engagement needs of the staff, and how that started to change, and particularly during COVID times, as Una mentioned, you know, people in services were there 24/7. Environments were changing. It was harder to get out to estates to meet with our tenants, and staff were working from home. So again, we're able to see the value and the transferability of TIP, trauma-informed practice for us as a housing provider, as a community service provider, but also as an employer. So I suppose what we've seen that, and some research has shown that organisations that are trauma-informed not only understand the impact of trauma on individual lives, but also work towards creating a culture that is healing and avoids further traumatisation. So for us, our journey began in 2020, is when we first linked in with Quality Matters and started having our staff trained. I suppose we realised early on that it was not just our frontline staff that we needed to get trained to become a trauma-informed organisation. As Una mentioned, you need to have absolutely everybody trained. To do that, we said, right, we need to develop a trauma-informed pathway, and part of that was around building capacity and confidence among our staff in helping them de-escalate difficult situations. And also, we identified that this would make us a bit of a progressive employer and make it an attractive place to work. As everyone knows, it's difficult to recruit staff now within the sector. So trying to have an environment that staff feel safe in and that they feel valued in is, you know, it's a bonus as well. So as we were beginning to talk through becoming trauma informed and how we could use this within our different teams and within the services and working with tenants, we began to see that, you know, getting from A to B is actually not very straightforward. It actually looks more like this. You know, life is not linear. There's so much happening around in the background. And it came up quite a lot for people that, you know, there's lots of different programs of development happening in different parts of the organisation. And there was comments like, oh no, here's something else, another plate to try and juggle. But we quickly identified that actually being trauma informed is the plate that everything else sits on. It's not another plate to sort of juggle in the air. So when we, you know, Una's hit on this earlier around ACEs or adverse childhood experiences. And what we were looking at, and what we've kind of coming to is a lot from within the different teams. So, you know, we'd have our homeless services team, we'd have our housing team, we'd have our then the likes of our legal team, development, finance. So, you know, very different backgrounds, very different ways of working. And, you know, obviously our housing and our services side, they work frontline, they're working with people every day. And the other parts of the organisation were kind of like, well, sure, what's trauma got to do with my everyday work? I'm designing a building, I'm, you know, paying people's wages. And it was to try and really look at actually trauma is part of everyone's lives. So obviously, you know, for someone working in a resettlement programme, they're dealing with it on a really acute basis, on a daily basis, working with people who've fled a war-torn country. When you're working with people in homeless service, like the example Una gave of, you know, somebody whose parents had a drug addiction, you know, of course, they're a very challenging part of that person's experience. But actually, if you look around your office and you talk to people about their childhood, a majority of them would have had one of these childhood ACEs, such as parental separation or parental mental illness. So, you know, it was trying to bring it home to our staff that actually trauma it is obviously the worst thing that can happen, but actually it can be very minor things that happen in people's lives too. So that was something that when we were able to, I suppose, open up that idea to people that this is more than just what happens on a difficult basis for people. It actually happens and can have happened to people in a much lesser way, but still has such a big impact. So just some brief information around adverse childhood experiences. The US research indicates that 87% of those who are homeless have reported experience of at least one ACE. cases amongst adults who are homeless in Ireland are higher than the general population. But then children who experience homelessness are more likely to experience significant issues as adults. There is less available to us on trauma-informed practice in general needs settings and ACEs, but I suppose that's something that we're working towards and trying to get a bit more evidence behind it. So how we decided to start building up our knowledge and evidence was we were looking from other organisations and in other countries, and what we started to do was develop scenario cards from all our departments. So we would have, a homeless example from our homeless service, from our family support, from our housing team, but also from within our HR team, because, they're dealing with people on a daily basis. They're going to have examples of how they could have had a situation where they dealt with used trauma-informed practice and a situation where they didn't, like we all can. They looked at socialising and communicating the wins. We were looking at upskilling, training and retraining staff, so keep training on an ongoing basis. We would have external speakers in to I suppose that's part of the retraining for staff, have lots of examples that we were sharing amongst the organisation and develop a yearly work plan. So I suppose for people who are starting out in this journey, I suppose it's something that we learned very early on, that it's persistence is the key. It is a journey. It's not something that happens overnight. There will be bumps along the road. For example, when we began, we said, right, easy first win. Let's do some building assessments and make all our buildings trauma informed. When we went to look into it, it was a lot more complicated. We realized very quickly that actually we really needed a rethink in how we were going to get started. So we got some external support in to help us develop our trauma pathway. We learned from each hurdle, and there's many times we literally had to stop and go back to the drawing board again when we realized that this is not working the way we thought it would. We developed a trauma change project management group, which is in line with and oversees a trauma change group. So our trauma change group will meet every 6 weeks, and that we've members of that from different parts of the organization to help try and drive it around the organization, so that we can keep it on the agenda and keep it relevant. And the management group oversees that trauma change group. And I suppose that the key to it all is to remember the why, that it works. We're doing this for a reason, and it will make a difference for our service users and our tenants. This is just a quote from a staff member at a family homeless service. Yesterday, I got such a high. One of my service users, who is quite young, I was trying to get her to go to counselling, but she has a lot of trauma, but she went. There's a lot of trouble engaging, but she went and engaged, and it's just, I couldn't tell you how happy it made me. And it's just, I suppose, an example of how invested our staff get within with the work that they're doing with our service users. So again, as I mentioned previously, it's a membership and buy-in from all the departments across the organisation is what we need to try and get trauma informed, or to become a trauma informed organisation. And that comes from the leadership, from the board, from the EMT. It's about working together as a team to collectively problem solve, so that we can look at all the difficult situations and de-escalate them, and to communicate the benefits of TIP, not just for the tenants and service users, but also for the staff. I think the staffing is a real key part of it all. So to date, we have trained about 300 staff, have participated in the full TIP training, which we partner with Quality Matters to run out that training for us. And we've had staff attend the full training from all areas of the organisation. We have rolled out refresher training to about 180 staff, and 2 of our staff have attended trauma champion training so far. What we also did was we developed bespoke training for non-frontline staff. So, staff who, like, for example, in our finance or our legal team, who, I suppose, as someone said to me, if I was asked to go on training for debt service ratios, I would probably cry. It was a similar sense from some of those staff, like, why would I need to go on this training? So we developed something bespoke for them, for them to be able to get something out of the training, and feedback's been really positive. It's a much shorter session, but again, it's giving them an insight into why we're developing and becoming a trauma-informed organisation. So it's just a quote from one of our tenants. If you're given a residence or a home by Respond, do not just put in there and left. If there's something wrong, something going wrong, you have that person you can call. You're not just a figure or number, you're a person. So these are the steps that we took and found some evidence of how of why you would do this in implementing a trauma-informed approach. About organisational change. It's about strategic planning with stakeholders. They're taking a flexibility to accommodate individual and organisational differences and needs. Staff training, education, encouraging and enabling continuous learning. Having staff support, including feedback loops and self-care tools. Reviewing your policies with a tip lens and identification of tools to measure success. And finally, I suppose this is a quote that one of my colleagues uses a lot, to think is quite appropriate here. And I suppose it kind of leads to why you would use a trauma-informed approach. So there comes a point where we need to stop just pulling people out of the water. We need to go upstream and find out why they're falling in. And I think using TIP is a really good example of how you're doing that. So you're identifying someone early on. You know, Una gave her example earlier of something that triggers them or something that causes them issues, and helping to identify that so that they don't keep falling back in, that you're stopping them from falling in the first place. And just a recommendation of a book. I don't know if any of you have come across Katrina O'Sullivan for Katrina is a lecturer in Maynooth University and has written about her experience growing up. And it's a really powerful book, really recommend it. But one of the really good examples Katrina gives is an example of one of the teachers who helped her when she was in school. I should actually give an example of a couple of different teachers, but one of the teachers in particular who really supported her, did very small minor things, but was able to support her to continue on with her education and saw who she was, not just the situation she was in, and really without the words of the time used a trauma-informed approach. So yeah, but that's me. Yeah. Thanks. Everybody.
Excellent. Thank you so much, Louisa. That was excellent as well, and some really good examples there. And before we came live, we actually talked about that book in terms of the impact on an interview I listened to last night and this morning, and just what real trauma is and how people can overcome it. And I think that's a key message, I suppose, from today and today's session, in terms of it is overcoming that trauma. But I think the examples from your own organizations are excellent. And I suppose just in terms of maybe kicking off on some questions, the funding for something like this, Una, for example, you touched on it. It's currently funded from your own resources, I assume, as an AHB.
Yeah, it is. It's funded from our own resources, and I actually think it's really welcome that like a body like the housing agency is having this kind of a series of events, because it really, like, to get to where we want to be, I suppose we need a community of practice where sector engaging in this kind of practice so that people aren't re-traumatized when they're going to other agencies. And I think actually it probably, like, a little bit maybe off topic, but it comes back, I suppose, to the point of funding services. And I know this is really relevant at the moment in terms of, and Rob, you were part of a really interesting article yourself a couple of weeks ago around the funding model for the new Housing First tender that'll be coming out, in terms of, like, I suppose there is a scope now maybe for added value when you're tendering, you know, and that we need to be incorporating that in, because it's so important. And it's very much speaks to what Louisa said about pulling people out of the river. We need to be able to, like, be delivering upstream models and sustainable models of moving people out. And, like, in order to provide those sustainable exit pathways, we absolutely need housing first and foremost. But we need to be preparing people, and we need to be recognising people's trauma, so we're getting them into a really good place so they can move out and have the confidence and the strength and the resilience and the skills to live independently. So, like, trauma-informed practice really adds to that, because it kind of accepts people as they are. It addresses their trauma, and a part that we're really keen to develop this year and next year, and I suppose it's just a funding that's stopping us at the moment, is a program to support clients to recognise their own trauma. A couple of years ago, Quality Matters hosted a conference in Dún Laoghaire on trauma-informed practice, and they had somebody with lived experience at the plenary session. And she said, like, don't tell me about my ACEs. I'm sick of listening about them. I want you to tell me that, like, the way I'm responding is because of the trauma. I'm not mad. I'm not crazy. It's because of the things I've experienced in my life have made me have these trauma triggers and these certain behaviours. So it's to support clients saying, you know, actually my behavior is actually kind of a normal response to the trauma I've experienced, and setting people up for sustainable exits. We don't want to maintain people in home services. We want to give them opportunities. So I do think the funding model probably needs to reflect that trauma-informed practice costs something, but that in the long term you'll have better outcomes for clients and it will be more cost effective.
Absolutely. And I suppose underpinning Housing First is trauma-informed practice in terms of what Samson Barris would have developed day one. It may not have been called that at the time, but as it developed, things moved along. So it was excellent in that perspective. In terms of maybe just another question, the resistance, and this could be to both of you, in terms of staff resistance across your organizations engaging in trauma-informed practice. And again, Louisa, you talked about some of the non-core staff kind of needing a streamlined program for them.
Yeah, I think, you know, as I said, it's more, I try to make it relevant to people and for them to understand that actually it's something that you can use in every part of your life. It's not just around working with somebody who's experienced a big trauma in their life. You know, if everyone just treats each other nice and respectfully, life would be so much simpler. But I suppose it's trying to talk to people where they're at, or where their brain works, I suppose, for want of a better way of putting it. And I suppose sometimes money talks, and actually that came up in that Quality Matters conference in Dunleary, and that was sort of a light bulb moment for some of us, that actually talking to the finance team and trying to show how being trauma informed can benefit in a monetary way. And like one example I have is we had one family that were having quite large rent arrears, and this has gone on for a long time. And you know, in other times it might have just been notice to quit, they have to go, and that would you're not going to get that rent, and they might sit there and you'd have to pay for RTB and all the cost and time that entails. But actually the housing team decided to take a trauma-informed and a different approach in this scenario. They went and met with the family. They realised that things had been going on within the home, that it wasn't kind of intentional that the rent arrears had built up. So they put in different supports in place. They wrote off some of the arrears, put a really good support plan in place with the family, got external supports in, and got a repayment plan, and the family, you know, are in a much better position now. Whereas, you know, taking a different approach and being, haven't paid their rent, they're not engaging, gone. And, you know, that would have cost time, money, redoing up the house, everything. Like, so there would have been a huge cost implication of doing that. But actually, by taking a different approach, it was a money saving thing in the long run. So it's I suppose it's trying to find how staff hear things, I suppose, is the key. And if it might be that it's a case of it's money, this will actually save us money. That might be the way in to get them to involve. Whereas someone who's social care trained, it's something that they feel in their bones, so it's not.
And I think it is the key point. There's a tailoring to sell this to staff as well. So I suppose from that perspective. But Una, if I could ask you the question, do you think trauma-informed practice, is it a cop-out for bad behaviour? We all experience it. I've been there in McGarry House, and I've seen what staff deal with. I've seen it in homeless action team presentations. I've seen it at a local authority desk. Is it a cop-out, or is there something more behind it?
I think that's a really important question, Rob, because I hear this all the time. What's an excuse for bad behaviour? And like internally, like within staff teams, and particularly actually, as Louisa said, when it comes to paying rent or accommodation charges in home services. Now we're trauma-informed practice, we're not able to go and ask them for their accommodation charge, and that's definitely not the case. It's actually quite the opposite. One of the, I briefly touched on the principles of trauma-informed practice, and one of the fundamental principles is safety. And I think you can't even have the other principles unless you have a sense of safety. And I think that's really important. And you can't have safety without rules. So in trauma-informed practice, you absolutely have to have rules. So that's a given. But maybe it gives us an opportunity to reflect on why do we have the rules? Like, who are they benefiting? So we can have this, put a different lens on our rules, like, and how do we deliver these rules to our clients? So if it's like an accommodation charge, you're like, we need the accommodation charge to keep the lights on or whatever. It's like, maybe this is a life skill for you. We want you to move out into the community, but you won't be able to do that unless you're able to pay rent. So it's just pivoting why you're implementing rules. But I think it's really key to like to say, you know, really clearly, like absolutely a fundamental principle of trauma-informed practice is safety, and that requires rules in all aspects of our lives. So I think it's really key, but it is a misconception because I suppose like you're maybe understanding behaviors that you didn't understand before, and you're taking a kind of a meandering route to addressing those behaviors. But absolutely, you need rules to have a trauma-informed service. It's key, but delivering them, maybe it might be a different way of delivering them.
Yeah, and I think the training is about, I suppose, making staff realize that they're trying to empower and how they can empower and deliver at the same time, which is, I think, really interesting. And I suppose if you're, again, bring it back to the local authority front desk or in a homeless action team, when you're dealing with somebody who is at their lowest point and they're coming to you day one, you often see all the manifestations of trauma, but you don't necessarily have the right environment, as you talked about, designing environments and designing the programs around that. And I mean, I think there's so much potential within trauma-informed practice that can be brought across the sector.
Absolutely, yeah. And I think that cross-sector thing is really important. I think we're limited in what we can do when people go out to maybe other services, and you know, they're met with the buzzer and they're outside the door and they're explaining their very traumatic, you know, homeless state, you know, or whatever the case may be, you know, and then they come back and they're re-traumatized and heightened, and you're trying to identify the trigger and bring them down again. But like when it's cross-sectoral, it will have even more impact. And fundamentally, at the end of the day, will probably cost the state. Like it's an investment that you're hoping that will have long-term outcomes, and you're sustaining people, so you don't have this, you know, revolving door, people coming into homeless services, prison, probation, emergency services, ED departments, you know.
Yeah. I think just something else that I picked up from both presentations, and I think it's client involvement. And I suppose Housing First is developed on the principle of client choice. And that's so important because you see everything then that flows, they feel included, they feel part of the decision. But you mentioned that involvement and the improved outcomes, associated with the client, including the client in decisions.
I think the client involvement and you know, we're definitely not there yet. And like, you know, we want to, like, it's definitely a strategic objective for us to involve our clients more. But it comes back to recognizing the strengths of your clients, you know, and just like, you know, homelessness is one element of who they are. It's not even an element, it's an external factor. And using their lived experience to inform how you operate your services and the type of care and support that you give people. And I think, you know, if you're not involving the clients in the process, if you're not asking them what is a trauma-informed service to you, you know, what, it's very limited what you can do, because, you know, what we think is trauma-informed might be entirely different to them. So I think that piece is really key, and utilizing their strengths and their lived experiences to truly transform the culture of the organization. And, you know, that lived experience really speaks to trauma-informed practice, because you have to have that collaboration to, you know, it's one of the fundamental principles of trauma-informed practice. So if you're not doing it, you're kind of missing something key in the cycle of it.
Yeah. Something that was said earlier, I suppose, reduce incidences. Louisa, is that something that Respond would have seen in some of your homeless services?
Yeah, we wouldn't have the measurements, and actually, as Una was, I recall a different presentation with Una looking at those stats before and thinking, yeah, we really should try and run something up. But anecdotally, absolutely, it reduced incidents. And I'd say the housing teams would say similar as well. But again, we don't have the evidence to back that up, but anecdotally, I would absolutely agree that it does reduce.
Yeah, and I think it can be something as simple. It could be estate management where there's less heated discussions, for example, like something as simple as that. You're delivering more positive outcomes across the board. So I think that's really interesting. And I suppose, and I know the next series of these discussions, Bob Jordan is going to be given an update in terms of the future of where the sector is looking at in terms of trauma-informed care. And I think that's really important. But I think the momentum that has been built, while this is only the second in the series, I think it's important to to keep the community engaged, and to keep the shared learning, because there's so much of what you both presented today, I think, is really applicable. And I'm not sure, Graham, is there any other questions that have come in on the chat? No? Okay.
No, nothing.
Okay. Well, is there anything else, Una or Louisa? Is there anything else you'd like to bring in? Okay. Well, what I might do just before ending, again, I mentioned that the next session there, it's going to be on the 27th of March at 2 p.m. and registration is open for that. So I'd say book it now. It's going to be a really interesting session again, and it's going to be focused on the topic of vicarious trauma and the self-care for practitioners. And that's something in terms of the Housing First community of practice. It's something that we focus on hugely. And again, it's protecting, because there's so much vicarious trauma in terms of what we deal with on a daily basis, not just in Housing First, it's across the board. It can be in your personal life, it can be in your work life. And I think it's so important to take into account as a risk factor in every organization. And it's about minding oneself in terms of that. So for that session, we have Dr. Breed Casey from DCU and Gary Broderick, who's the CEO of the SAIL project. So I think that's going to be a really interesting seminar. And as I said, Bob Jordan is going to pop in and will be given an update on the next stages of trauma-informed practice as well. So again, that's just the 27th at 2 p.m. So to register for that. And then I think it's just to finally to thank Una and to thank Louisa for your time today. I think that was really good, really informative. I've got a load of notes here to take with me to ask some more questions along the line as